Hello and welcome back. I'm Dr. Alison with Little Black Bag Functional Medicine, and today we are getting into episode 2 of our 4-part May series on brain health. So last week we laid the foundation. We talked about the 5 big drivers of brain fog, including hormones, infections, sleep, mood, and insulin. And I told you today that we're going to talk about infections, especially the post-viral piece, because in my opinion and what I've been seeing in my practice is that this is the most under-recognized driver of brain health symptoms right now in women of every age. So today's episode is called Long COVID and the Brain, but I want you to hear me when I say that it's not just for the women who know that they have long COVID. This is for anyone who has just not been the same since maybe having mono in college, or you had a virus 3 years ago and your brain's kind of been different ever since. Maybe you were doing great before and then you got sick over the winter and now you just don't feel like yourself anymore and everything's normal and everyone tells you they don't know what's going on and maybe just give it some time. This is all for you. And honestly, this is also a personal story episode because I've been living this. I touched on it last week with how I went through mono in high school, COVID in 2022 that gave me mast cell activation with full body hives, developing POTS, asthma, chronic fatigue, and the protocol that worked. So the 5-virus winter that almost broke me, then being able to use nicotine patches and my protocols and feeling like myself again finally. And then this year in February 2026, when I got COVID again, thankfully only one time this winter, but it took about 3 weeks when I started to lose my brain function and could not focus at all. And so I'm going to share a lot about root causes, how we can test for these things, how we can understand them, and the protocols as well. So there's a lot of information here. And if you're listening while you're driving, or maybe you're hiding in the pantry from your kids, don't worry, just listen. Everything I talk about will be in the transcript on my blog at Little Black Bag Medicine with links, maybe labs, protocols, things like that. And of course, as always, when I share on this podcast is for educational purposes. It's not personalized medical advice because we don't have that relationship. But if you are looking for support and personalized care, you can find me again at Little Black Bag Medicine to start the new patient program. And we also have a new program launching called the Mama Brain Reset. And doors are open as of today, and we'll tell you a little bit more about that at the end. So let's really talk about what is long COVID really, and why am I lumping it together with Epstein-Barr virus, Lyme, mold, and all of the other chronic viral and infectious patterns we see. Long COVID, by the loose definition, is symptoms that persist beyond about 3 months after a COVID infection. Brain fog, fatigue, POTS, mast cells, sleep issues, joint pain, mood changes like anxiety and depression, and exhaustion, that MECFS that shows up and does not respond to rest. So the research is showing that this is happening in roughly 10 to 30% of people who get COVID, depending on which study you look at, of course. And we're talking about millions of people walking around with post-viral effects that nobody has named for them. And this is the part that I really want you to hear and understand. Long COVID is not actually new. The mechanism behind it is the same mechanism that's been driving post-Epstein-Barr or monochronic fatigue for decades. Same with post-Lyme syndrome, and it's the same with mast cell activation after viral or bacterial infections. And it's the same mechanism that triggers autoimmune flares in women who were stable for years. So all of these patterns really share one thing. The immune system gets activated by the infection, and then it doesn't turn off. The microglia of the brain stay activated. The mast cells stay leaky and activated and constantly producing histamine. Our autonomic nervous system becomes and then stays dysregulated. So when we used to be sharp, we used to have a ton of energy, have a normal menstrual cycle, and a healthy, happy mood, we find ourselves living in a body that doesn't feel like our own anymore. And I think that the research is finally catching up to those of us in functional medicine and who have been living this, have been seeing for years. There's a paper from Frontiers in Microbiology that does a great job laying out the mechanisms about viral persistence in tissues, how it's staying there, microbiome disruption in the gut, reactivation of latent viruses like Epstein-Barr, meaning that when you have COVID, it can trigger the remaining viruses in your body to reactivate and become active again. So you have a full mono experience all over. And they're also talking about how it's related to autoimmunity, microclotting, mast cell activation, like we talked about with nervous system dysregulation. And what's hard is all of these things happen at once. It's not just one thing, it's like a cascade of what's happening. So let's zoom in on what this looks like in the brain specifically, because that's what we're talking about today. And I would say it's also the most common symptom that I've been seeing alongside of the horrible fatigue. So when a virus activates your immune system, your microglia specifically, which are the immune cells of your brain, those get turned on. And normally that is exactly what's supposed to happen. We want that. Those microglia clear debris, they fight the threat, and then they're supposed to settle back down. Like the inflammation of our immune system should be higher and come lower and stay at a neutral position. But in most viral patterns, they're not settling back down. They stay activated. And what happens over time, these activated too, microglia release inflammatory cytokines into your brain tissue, specifically IL-6, TNF-alpha, IL-1 beta. So all of these cytokines disrupt how your nervous system talks to each other, how your neurons in your brain talk to each other, and it's just creating more inflammation that it can't clear out. And that is what brain fog is. That is what the lost word is, or walking into the room and forgetting why. It's not necessarily a personality trait. It's not bad sleep. It's not just stress. Or, it's just perimenopause and we just need to deal with it. It is literally your brain screaming at you that something has been going on for too long and your brain is paying the price. So here's where some things get really interesting. The blood-brain barrier, which I love to talk about, is supposed to keep certain inflammatory molecules out of your system, but it also gets disrupted during long COVID and other post-viral states. So the blood-brain barrier protects and wraps around the arteries that come into the brain. So it's actually very hard to get things through that blood-brain barrier. It's similar to leaky gut. We can also have a leaky brain where those protections start to get broken down. So this is why long COVID brain fog can be so much worse than regular fatigue brain fog, or even hormonal as well, which usually just compounds it because now we have a structural component to it as well. And then on top of that, we have this autonomic nervous system piece. POTS, which stands for postural orthostatic tachycardia syndrome, is now showing up in huge numbers after COVID. So much so that they're just calling it a social contagion instead of actually, first of all, actively treating COVID or any other infection and getting immediate support afterwards. So with POTS, your heart races when you stand up, when you change positions, when you literally do anything. You could roll over in bed and your heart rate will spike. This is also a long COVID brain symptom and nervous system symptom because it doesn't always look like one. And if we think about it, if your brain isn't going to get consistent blood flow because your heart rate's going up, it's going down, and your blood pressure is as well, your brain is just not going to be able to think consistently. And when I talk about this long COVID brain, I'm talking about a few things at once. So one, we have the microglia activation and brain inflammation, two, the blood-brain barrier disruption, and then the autonomic dysfunction. And we're going to get to how I work with all three, but first I want to tell you a personal story because I think it lands a little differently when you know it's coming from someone who has lived it. So here is what I touched on last week. When I was in high school, I had Epstein-Barr virus. A lot of people abbreviate that as EBV or just know it as mono. And I was told what probably every teenager then was told, that good news is you can only get this once, get over it, get some sleep, drink some fluids, you'll be fine. But then I had it reactivate in college, and I was like, wait, I thought I could only get this once. Then I had it in college a second time. So 3 major hits, and each one had knocked me out for about a month, where I had to quit school and do everything at home. Thankfully, I was able to back then. and then get caught up once I came back to college, and then keep going somehow through finals and all of that. And I just kind of stopped thinking about the fatigue and how I was functioning because no one seemed to think it was a big deal. And looking back, I feel like Epstein-Barr has absolutely been reactivated multiple times over my life, but I just didn't know what to look for, or I was told, no, that can't happen. And what I want you to know is that we absolutely can test for this, and we can run a PCR to see if it is currently activated in your body. We don't have to just rely on the immune test, which tells us if you've ever been exposed. So Epstein-Barr is technically a herpes family virus that lives in your B cells of your immune system for the rest of your life after you get it the first time. So these things can reactivate during periods of stress, immune suppression, like I had to start taking all of those immune suppressant drugs to survive ulcerative colitis. It can also happen during hormone shifts or other infections as well. And so this reactivated Epstein-Barr is associated with a long list of chronic conditions, including chronic fatigue, multiple sclerosis, lupus, Hashimoto's, brain fog, cognitive symptoms, and this is all layered into everything that's going on in our health. So when 2022 happened, I had COVID, and it was so classic because we were seeing it take about 8 days from the initial infection, which is a long time ago. You know, that's 2020 to 2022, where most people were seeing their initial first time ever infection. And from there, I broke out in hives, like from head to toe, not just like a little rash, but full body welts that burned so badly I couldn't sleep. And then I developed asthma. I've never had asthma in my life. It was so scary. And then I developed POTS, and my heart rate would spike, and I couldn't get out of bed. I needed propranolol to function. And then the chronic fatigue and the CFS, and it was so severe. I saw immunologists, I saw allergists, I saw functional medicine doctors I respected, and no one could really help me. And eventually I had to dig in and just build my own protocol alongside of everything else that I was working on. We had to work on the mast cell stabilization piece. I had to work obviously on my gut this whole time. We had to do a lot of histamine and methylation work, nervous system stuff, but it takes a long time. Really, last year, my story turned mainly because my husband Jake was reading research on nicotine and hearing about it on podcasts, and I remember hearing about it in 2020. I was like, oh, because the only thing people were talking about was smoking cigarettes, is that I could find from 2020. So I kind of ignored that. But then people who were using nicotine patches were seeing the differences with it as well. And mainly because it's binding to nicotinic acetylcholine receptors that get overtaken by these spike proteins from the virus. So when I did a deep dive into the literature, which didn't take long because there's not much out there, but I started using the nicotine patches in March of last year, and it took time. It took about 5 weeks before I could take a nicotine patch off and not have my heart rate destabilize. But it took about 5 weeks. Yeah, 5 weeks. And I was able to go to the zoo with my son. We started playing pickleball. My heart rate was managed, and eventually I didn't need them anymore, the nicotine patches as well. And then in February of this year, when I had COVID again, it was not the worst case I ever had. We've had worse, I'll write it out. And I didn't even think about nicotine and all of my protocols. I was just like, oh, this isn't bad. I'm just a little tired. It'll be fine. Knowing that I should have had those on the second that, honestly, my son started to get sick before I started to get sick. And it took about 3 weeks later when these long hauler symptoms hit, like severe brain fog, POTS back in full flare that I hadn't been dealing with for almost a year, the chronic fatigue that meant like I couldn't unload the dishwasher. And honestly, working with my clients, I was like, oh, I'm having a really hard time. Like, I had to give all of my energy to them and come back to bed. And I was really surprised about that 3-week timing. And I think that surprises a lot of my patients as well, because that classic post-viral timing in early COVID was 8 days. But now we're seeing that those effects can show up weeks or even months after the initial infection, and it's probably reactivated a lot of other things going on in your system. So if you've had COVID or the flu or a stomach bug 6 weeks ago and now you're feeling terrible, don't let anyone tell you it's not related, because your immune system has a memory, and that memory can take time to fully express itself. So what am I doing right now to heal? Because I'm still in this. I'm almost clear. I'm really excited. Been working really hard. Been really, really consistent. And I'm still healing as I'm recording this episode. But this is the protocol that I'm going to walk through with the women in the Mama Brain Reset group. And I want to share the bones of it with you as well. So first things first is mast cell stabilization. Because once your mast cells are leaky, I don't even like that word, but really overactive, highly triggered, they keep dumping histamine and other inflammatory mediators into your tissue. And that drives a huge portion of long COVID symptoms. So we can use things like quercetin, higher doses of vitamin C, luteolin. We can use a low histamine diet, which is actually really important, especially when you're in a flare. Over-the-counter antihistamines in combination. So we have H1 and H2. So this is where you're seeing Pepcid and famotidine come in. And then on top of that, like Zyrtec and maybe Allegra. I see a lot of people have good success with that. We want to use supplements that are helping break down histamine, but as well as stabilizing the mast cells like DAO, and then watching our probiotics, because a lot of people take probiotics thinking it's going to help their histamine, but it's actually quite a few probiotics that increase histamine in the system. So you want to use probiotics that are safe. So make sure, I love the brand Seeking Health. They do a great job with a lot of antihistamine support there as well. All right, so second, the nervous system, because if your autonomic nervous system is dysregulated, you can't really heal as quickly as you need to, and you're still going to have these wild up and downs and flares that seem unmanageable. So we want to do vagus nerve work daily, but a lot of people are doing this with humming or a little bit of breath work, but we need things that are going to be really, really effective. So I use my own neurobalance program that I work with my clients, because it's using post-concussive physical therapy to be able to heal and support the brain's functions, connect all of the lobes together, bring better proprioception from our body to our brain and vice versa, and really calm things down. I love to use frankincense oil on the back of my neck for the brainstem support at night, and then, of course, prioritizing sleep. So when people say, oh, if we do some humming and some singing and some yoga, that's going to heal your nervous system. But we actually have to be much more active, which is why you'll see most functional docs recommend things like gargling with water till tears form in your eyes, gagging with your toothbrush on the back of your tongue, to do that every morning until tears form in your eyes, because those tears tell us that your nervous system and your vagus are being activated. So there's a lot more that we have to do to get the nervous system to come online. Okay, third, the antiviral and anti-inflammatory pieces. So there's a lot of options when it comes to antiviral that are more antimicrobial herbs, if you will. So I like to lean on monolaurin, which is most commonly known for Epstein-Barr and other enveloped viruses. I really do like lysine as well, but with those, we do have to be very consistent with them. I like that the herbal antivirals from Stephen Buhner's work, Buhner, has been incredibly helpful for that Epstein-Barr and the Lyme overlap. Specifically things like Japanese knotweed, cat's claw, and Andrographis. I also use copaiba and frankincense essential oils for the neuroinflammation, because those boswellic acids and the beta-carophylline compounds do cross the blood-brain barrier and change inflammation right where it's happening. And this is something I want to mention, because it surprises people. The other thing I really like, but is a prescription, is low-dose naltrexone, and that can be a game changer. It can help support and change the immune system to reduce that inflammation. It's generally well tolerated, but it's worth asking about if you're not getting the right traction with other protocols. Okay. Fourth is methylation support, which I really like to hone in on, because if your body cannot methylate and change over the vitamins that you're bringing in, like most people think of B for methylation as well, you're not going to be able to clear out histamine, make neurotransmitters, recover from inflammation, get good sleep. All of those things are required there. So I like to use a methylated B complex with methylfolate, methylcobalamin, P5P, and folinic acid. And none of those synthetic B vitamins, because those just clog up the receptors without doing the work. And so many people are worried if they have MTHFR, what they need to do for it. They want to blame everything on that. And it's true that it matters. And we also know that about 40% of the population has at least one MTHFR variant. Most of them have no idea. So you can get the genetic testing done if that's something that sounds interesting to you. But in the end, I think everybody should be just taking methylated versions of B vitamins for support and not worrying about spending the money on genetics for that specifically. Genetics are great for a lot of other things. Okay, then blood sugar stability is incredibly important because the long COVID brain is doubly sensitive to insulin swings. So we don't want to skip breakfast, you don't want to skip lunch, you don't want to binge at night, we don't want to rely on coffee and caffeine and energy drinks to keep us up, which honestly all it's doing is probably keeping your heart rate really high and you're still really tired. So this, I feel like, is the hardest part, because waking up to have breakfast with protein and fat takes effort and it takes time and it takes a lot of resources as well. But in the end, it's worth it because all of these things are leading you down that healing path. We need a lot of protein and fat. We need a lot of nutritional support and nutrient-dense foods as well. And I know that you wake up and you're not hungry and maybe you don't even have time, but this is where I see a lot of women missing the mark in their healing process. Also, we can use things like MetaPower oil or berberine for extra support for insulin sensitivity. And that way you're using the insulin, using the nutrition into your cells so you can have that energy back. The energy crisis is a little bit different, and we'll talk about that in a different podcast as well because I really want to do a deep dive. The other supplements that I have included for myself are quite extensive, and I think this is where my warning comes in with this conversation because it's really tempting and really easy to get online, listen to podcasts, read blogs, be in social media groups, and all of a sudden you're like looking at 100 supplements on your table or in your pantry or in the cabinet, and you're like, I can't even stomach this much. I don't even remember what I'm supposed to be taking. Is any of this working at all? So I have a mixed view on all of that because personally what I've experienced in my own health is, yes, if you're dealing with issues like this, you probably need to be on a ton of things to be able to see a difference. Now, someone who's healthy and doesn't have long COVID and doesn't have hormone issues, they probably don't need to be on anything, but we're here because there's something going on with your brain and your energy systems and your immune system. So when I list out all of my supplements, it's like, wow, that's a lot, but at the same time, I'm going to finish those bottles and know I'm going to be on the other side feeling a lot better. And for you, you might start with one thing and then add another thing on and then add another thing on. That's probably the best route to go. So where I started was, number one, nicotine patches. Doing 7 milligrams last 24 hours. Take them off after 24 hours and rotate sites as well. Number two, I use a lot of glutathione. It's liquid, it's known as trisomal, so it can be absorbed into the bloodstream and be way more effective for energy and our immune system clearings, and it's also a great antioxidant. Also in my fridge is a bottle of liquid chlorophyll for all of the energy systems and support and digestive support and cooling my system as well. I take omegas because our brain needs so much fat, and it's also incredibly supportive for hormones and fat. I take MetaPower insulin support, so they have the capsules with the herbal blend in there, like berberine, for my energy. I take Mito 2 Max from doTERRA, which is for mitochondrial and oxygenation support, and I've doubled the dose on that as well. I use Heart and Soil liver and beef organs, as well as the Her package. I take those daily, but I have to go down on that dose because it's a lot. It's a lot of capsules to take. And Revitazen from doTERRA. I make sure that I take that every single day for liver, kidney, and colon support and keeping things moving for me. And the other thing that I'm not on right now because of the surgeries, but I have probiotics that are histamine safe. So if I'm having a histamine outbreak with that as well, we're adding in Zyrtec, DAO, and then the Histamine X from Seeking Health, because those are the probiotics that are safe and get things moving and cleared out of the system as far as histamine goes. So that's a lot, right? That's a lot to remember. I'm not perfect with it. There's a couple things that I'm perfect with, like the nicotine, because it seems to be the most effective and the most speedy in helping me feel better, if you will. So take what you already have in your pantry and start, one, throw anything out that's expired. Two, get to understand what you do have so that way you don't have to reorder more things. But three, make a plan that you're going to be able to work with, because we need you to be consistent. We need you to have all of the support. You should not be living like this at all. And I know how difficult it is, and I know how frustrating, because it takes forever, but you have to hang in there. And there's a lot of protocols that you can try. So give it at least 6 weeks with these protocols. With my patients who have been dealing with this for, let's say, an acute amount of time, like you've had an infection within the past 3 to 6 months, I would say it's going to take about 6 to 12 weeks to see a huge difference. If you've been dealing with this since 2021, 22, you're probably going to need about 6 to 12 months to start coming back. And I say that so you have a better validation of your experience, because you're going to be like, Alison, I did all this for a week and nothing changed. I'm going to say, I know it's so difficult. Keep going. And then if you do that for 6 to 12 weeks and you're like, nothing has changed, then something else is going on. Okay. So I want to tell you a little bit about a patient story who came in, who was here with me last fall. She was 39, 3 kids, been a marathon runner, and she got COVID in early 2024 and never really came back to herself. So by the time she had found me, she'd been to a neurologist, cleared, awesome. Cardiologist, cleared, go, normal, POTS, maybe. Rheumatologist, because they were concerned all the joint pain was arthritis. And then obviously her primary. So all of the testing came back normal. Autoimmune panel was normal. Everyone told her, like, your labs look great. Maybe you're just deconditioned and you need to get back to exercising. But every time she tried to run, or God, even go up and down the stairs, heart rate would spike to like 170 within just a few minutes, and then she would crash for a few days afterwards. Her brain fog was so bad, and she was just crying because she had been told this is also psychological. Maybe she should see a therapist. She was also one of the ones who had been told, like, oh, you just need to see an autonomic specialist. There's no such thing. There's no such thing. So what we found when we looked is that she had an early Epstein-Barr antigen that was active. Her PCR was positive. Her T3 was at the bottom of the range. Her morning cortisol was crashed, but her evening cortisol was elevated, so that pattern was flipped. Her ferritin was 18, which wasn't horrible, but it was enough that we had to look at that again as far as iron consumption. And she has clear signs of mast cell activation in her history. So we built a protocol because we wanted to do first that mast cell stabilization, because she was so reactive from food and so many supplements. We layered in a lot of slow antiviral support. We worked on the cortisol with adaptogens, but also timing and reworking some lifestyle things to get cortisol up in the morning and down at night. We did a lot of iron work, which takes time, and we had to play with a couple different types of iron to get that ferritin up. And of course, stabilize blood sugar because food started to fall off the plan because she was so fatigued. So what we did was built a pacing protocol that respected her energy and didn't have to focus on pushing and crashing and doing too much. Well, we're always going to do too much. We had a couple flares within that, but within 6 months, she was able to start doing yoga, doing some short walks, and eventually back to light jogging. And it was such a miracle to be able to witness someone come back to who they were in their heart and in their energy as well. And especially when all of your testing and all of this running around is coming back normal. Really, really difficult. So if you're feeling like this is you, I get it. This is a lot. The post-viral world is a lot, and it's been carried almost in silence for so many years, not only since COVID, but really with Epstein-Barr. And Epstein-Barr being so closely related to all types of autoimmunity is where I feel like women are suffering. And I'm seeing so many women come in with a history of Epstein-Barr or unsure if they've ever had it, and we can test that with blood work very easily. So anyone who's been ever diagnosed with chronic fatigue syndrome, fibromyalgia in the 90s and the 2000s, we've all been told the same thing. Like, it's anxiety, it's overdoing it, not delegating, not doing self-care, autoimmunity is just genetic, it's just nothing you can do about it. And the sad part is all post-viral, and we just didn't have the language for it yet. And even if we did, the people who needed to be listening weren't able to listen or weren't exposed to this information. And so if you're dealing with this, you're not alone. You've never been alone, even though it feels that way. And two, this is treatable, it's supportable, and not always quickly, not always like literally, like we know the path, but we have these real protocols and they work, and you can come back for this. And I'm living proof of that. And so are dozens of women in my practice. So let's talk about a few action steps, because here's what I would want you to know, and here's what I have written down, because we want to just leave this with information and things that you can take steps on, not, oh my God, yeah, she's right, I don't feel good, I do have all those things wrong. Now what? Now what looks like beginning with labs. Of course, we want to do an Epstein-Barr antibody panel. We want the different antigens for that as well. That tells us about reactivation. And we have to look at the full one, the early antigen, the nuclear antigen, the BCA of IgG and IgM, because the labs keep cutting back on what they're offering in standard panels, so we have to specifically ask for it. And then we have to ask for the PCR as well, because we want to see if it's currently active in the body. We also want to run other titers on viruses, because those herpes family viruses tend to travel together, and if one is active, others often are, like cytomegalovirus, HSV, and HHV. The other thing that we want to look at is the Lyme and co-infections, especially if there's any history of tick exposure. But the classic Lyme from Quest or LabCorp miss so many cases, and they don't test as deep as the big functional panels do. But I also understand that the functional panels like IGeneX, that is IGENEX, and then the iSpot, which is just the letter I and SPOT, those Lyme tests can get very expensive. So if you can at least get started with a Quest and get that covered, that would be awesome. The other thing that we want to use is mycotoxin or mold testing. This is really common because people live in homes that have been exposed to mold, have a history of water damage, or maybe your old house did, and we just have no idea. So we want to use mycotoxin testing to see if that is actually added into the biofilm of the gut and what's keeping you sick as well. We want to run full inflammation markers like CRP, homocysteine, ferritin, fibrinogen. These are not just specific to post-viral, but they tell us how loud that inflammation is. Of course, we're always going to run a comprehensive metabolic panel, so that way we understand blood sugar, kidneys, liver, all the good function ones, full thyroid panels, and antibodies, because so many people are dealing with what we call it subclinical Hashimoto's, where their thyroid, that TSH, is just crawling up a little bit, but not enough to need medication, but we're seeing those antibodies pop off, which means that we need to be treated a little differently. For hormone panels, if we need that to help stack on the brain health, I love to use the Dutch test because that gives us that full picture of estrogen, progesterone, testosterone, cortisol patterning, and it helps us understand if there is a genetic component, a mitochondrial component, or a hormone component, so we can support correctly. And so we can do this with your insurance, through blood work, and then insurance doesn't cover functional testing like the Dutch or the IGeneX or the GI map, things like that. So we want to get that to you for a good price as well. So I feel like obviously the medical conversation around long COVID was non-existent when it popped off, right? So 5 years ago, or 2021, there were people who were kind of complaining about the chronic fatigue and the mast cell in some communities, and now we have all of this research that's coming out on how viruses, not only just COVID, but have activated all these other things and how they're affecting the body. So we now have major investments in research, hopefully leaning towards treatment. We have NIH funding. We have a real research agenda. We have tons of functional clinics, mine included, that have been building post-viral protocols for years that are finally being validated by the research. And so as a personal note, on a personal level, every woman I've walked through this with, who I've been able to hold hands with for whether it's a few months, or, a few weeks, a few months, maybe over a year, has gotten better. And not always quickly, but meaningfully, measurably better. The one who says, I'm falling asleep at work at my desk. I'm falling asleep with listening to my clients. I work with so many therapists who are just heartbroken that they can't pull up that family information or what their client said last week because they're so dedicated and their brain just doesn't have that capacity. So when we bring that back online and their energy comes back, the capacity comes back, it takes a real protocol. It takes real intention. It takes someone seeing that big picture, because this fatigue is not just something that comes and goes. It's not something that just will slowly get better over time if you just wait it out. We have to take care of you now. And if you've been told that long COVID is permanent, or this is just what it looks like now, you shouldn't need to learn to live with it. There's a different story available to you, and there's a lot of options out there for you. So they're wrong about that. There's a lot of hope. So bringing us to a close, I want to tell you about the Mama Brain Reset because I'm really excited about it. It is a 30-day root cause program for women dealing with brain fog, the lost words. Maybe it is long COVID. Maybe it is perimenopause. Maybe it is post-viral, something that we talked about. So we're going to work on those 5 drivers that we're talking about using daily essential oil rituals of ones that we're going to rely on the most. We have a brain recovery plan program that's going to walk through the labs, the supplements, the protocols. We're going to have live group calls. You get one private consult with me to start building out that plan for you. And then we have a private community, so you're not doing this alone as well. So if you've been listening to these episodes, seeing yourself in them a little bit, this is the door. We have this program here for you that starts May 24th, and it runs through June. The investment is $247 all in, which is pretty going to cover a lot of what you need as well. So to get the details, look at the description here. Find me on Facebook by my name, Alison Goggin, or Little Black Bag Medicine, and message me. Let me know what's going on, and let's get you started with this. So whether you join us in the program or not, I would love to leave you with one thing. If you're dealing with these post-viral symptoms, you're not alone. There is a path. The path is not the same for every single person, but there is one. And finding the right practitioner who knows how to look for it, how to ask those questions, what labs to run, can order you labs, knows the protocols, that is what I'm here to do for you. So thank you for being here. Reach out, DM me, email me, visit my website, schedule online, because I'm so glad that you're here and listening. and taking the time to take care of you. So I'm proud of you. You're doing a great job. Make sure to like, subscribe, and share this episode with anyone that may be going through this as well. So we'll see you next week. Have a great one.